Do you ever wake up in the morning and feel a sharp sensation in your feet, around your heels or around your toes, and you wonder what is the reason behind this? Well, today we are going to crack down on all the reasons that this can happen to you. My name is Atharva, and you're watching the Good Feet podcast. Once again, I'm joined by Dr. Sarika Jambhulkar, and we have so many more questions for you this time. So today we are tackling heel pain. I want to know from you कि heel pain is one of the most common problems in India, and does it happen just because of aging or is it something else?
See, heel pain, or it's also called as a plantar fasciitis. Now, there are various differential diagnoses for the heel pain. It could be plantar fasciitis, it could be calcaneal spur. If the pain is at the back side of the heel, it could be Achilles tendinitis or retrocalcaneal spur. Okay. Now, all of them, these are basically overuse injuries. In medical term, we call it as a cumulative trauma. Okay. That's why it's more common in the middle age. Now, we we keep standing or walking throughout the day, and everyone has a different level of the lifestyle. It's very much common in housewives because they stand a lot in the house, and many times they are standing bare feet. Okay. Even if someone is doing walk or exercise, many females, they opt for a slip on shoes because they are easy to wear, but that doesn't offer enough support for the ankle, and that's why then again they will start developing the heel pain or some other foot problem. So number one, walking bare feet a lot. Second, using wrong type of the footwear, and obviously lack of strengthening exercises. This is the more common reason for the heel pain.
Okay. Roughly how many people out of 10 suffer from heel pain would you say?
It's actually, I will say, common household problem. You knock at the house and there will be someone who will have a heel pain. Okay, so 8 out of 10 also.
Doctor, can you explain plantar fasciitis in simple terms?
Sure. So plantar fascia, it is an elastic ligament. It's an elastic band which is present under our feet. Okay. Now, whenever we are coming from sit to stand, our body weight comes on the feet. That is the time our arch stretch a bit, and that is when even the plantar fascia gets stretched. So this plantar fascia gets into shortening and stretching with each and every step we take. Okay, and that eventually creates the inflammation at the point of its origin, which is the heel. Okay, and that is why plantar fasciitis. Itis means inflammation. So plantar fasciitis means inflammation of the plantar fascia. So eventually it creates lots of irritation and inflammation around the origin of plantar fascia, and that results in the heel pain. So each and every step we take, plantar fascia is going to stretch and relax, and it is a normal phenomena which happen with everyone. But depends on that person arch pattern. Sometime it can go into overstretching. For example, if someone has a flat foot, the plantar fascia is going to go into overstretching. Even someone who has a high arch, the plantar fascia is going to be more stiffer side. Okay, so the stretching will be limited, the shock absorption will be less. So the plantar fasciitis can happen with someone flat feet also, or someone has a high arch also. So that creates more irritation at the point of its origin, and that result in inflammation. That's why the plantar fasciitis happens.
And I think I have seen a lot of young age people also complaining about heel pain, so it's not just happening with old people. I guess it has to do a lot with your lifestyle and how you move about.
Yes, so it's more common in the middle age. It become more intense in the middle age, but obviously now it's starting all early, like at the age of 25 or 30 also. It's
Okay.
more common in females.
Okay. So most people who complain about foot pain, heel pain, they say that it hurts really bad in the morning when they wake
Yeah.
up. What is the reason behind that?
Yeah. See, when you're resting for 5-6 hours in the night, okay, your foot is relaxed, the plantar fascia is slightly shortened, okay. And when you take a first step, as I mentioned, when the body weight comes in, plantar fascia stretches. So that first stretch in the morning, because the plantar fascia is already relaxed throughout the night, that causes intense pain. Also, there is something called as a muscle sleep. Like when you're resting, your muscles also relax. So muscles are also kind of go in the sleep. So initial few step it hurts more. The person will walk for some time. The muscle gets bit activated. The fascia get loosen up, and they feel better. So plantar fasciitis is one of the most common condition. Most of the middle-aged females and males experience this plantar fasciitis problem. Okay, and it is a typical injury because of the overuse of the plantar fascia. Most of the patients who come to us, they are suffering from the plantar fasciitis for 2 years, 3 years. They tried various medications, therapies, and then last resort is they took the steroid injection also, but still that the pain persists. So most of the time they feel like they lost hope basically that they will be able to ever walk pain free. So main reason of the plantar fascia is their faulty foot arch pattern. So if we'll support the arch, it will reduce the stress on the plantar fascia and it will directly take care of the pain. Now many times doctors will also advise patient reduce the weight. Now reducing weight is not easy, and if someone has to reduce the weight, they have to walk, they have to exercise. Now if they will walk more or they will exercise more, the strain on the plantar fascia will increase, so their pain will increase, so they can't do that. So the patient gets stuck in the vicious circle that because of the pain they can't walk, because they can't walk they will gain more weight and their pain will increase. Okay, so with the right footwear, right shoes, right insoles, we can break that cycle. So the patient will get pain relief first and then they can work on the exercises to reduce their weight or to strengthen their muscles.
So, what I've heard, mostly podiatry is a non-surgical field,
Yes.
and you guys try to avoid invasive surgery as much as possible.
Yeah.
So, can you tell us about some of the tools and uh, some of the things that you use in your treatment that
Sure.
help you avoid digging into someone's skin?
I can categorize podiatry into two parts. There are surgical part also in the podiatry, okay, which involves surgical treatment for the bunion, if there are any foot fractures, etc. What we are practicing here is mainly non-surgical part, okay, and there are many conditions which can be managed without surgery. For example, reoccurring corn and calluses, okay, ingrowing toenail. Many time patient feel ki if I will get this corn removed surgically, I will be sorted. But even post surgery, it will reoccur because the main root cause of the corn is when he stand and walk, they are exerting more pressure on that area. That's why the corns are happening again and again. So unless and until we rectify that root cause, the corn will not stop reoccurring. So what we do is, on the day one, we analyze their foot pattern, their walking pattern, and we see why on the certain areas of the foot they are exerting more pressure. Then accordingly we'll prescribe some corrective orthotics which helps to redistribute the foot pressure. So the corn will start coming out. And then we use certain tools where we can remove the corn non-surgical way also. Okay, and main is the corrective orthotics help to prevent the reoccurrence. Same with the ingrowing toenail. Many times patient undergo surgery like removal of the entire nail, removal of the partial nail. But the new nail is going to grow, and usually the new nail start giving them same problem again and again. So rather than removing the entire toenail, suppose if we'll trim only corner of the nail, which is again non-surgical procedure which we do at the clinic, and then side by side we can diagnose what is the causing factor. It could be the using tight shoes, or it could be something with their footwear, their feet are broad and all. So accordingly, if we'll manage that condition, they eventually they can get rid of the ingrowing toenail also. As I mentioned earlier, India has a big number of diabetic patients. Now, typically, most of the corn patient they use the corn caps, which has the salicylic acid which is not skin friendly. Now, even non-diabetic patient, the corn caps doesn't help. But if the diabetic patient use the corn cap, that simple corn catch an infection and it can get converted into diabetic ulcer. Rather, even on the packet of the corn cap, there are instructions written that a diabetic patient should not use the corn cap. But still, because usually in India, people don't follow doctor advice, they will follow the uncle auntie's advice, right? So they use the corn caps. And we have seen many patients who had a corn, they used a corn cap, and because of the diabetic it went into diabetic ulcer. Now it can be very dangerous, their foot can go into gangrene, cellulitis, and it can lead to amputation, right? So you can imagine one simple mistake can cause so much trouble. So even with many diabetic patient, they live with the ulcer for many years, like 2 years, 3 years. They have imagine non-healing ulcer in the foot. They are standing, they are walking, they are going to the work, right? So that's why, because there is no offloading done for the diabetic ulcer. That's why the ulcer doesn't heal. So obviously we can't expect that person will be, bedridden because of the ulcer. Rather, if we'll change the footwear such a way that if we'll offload the ulcer, that whenever he stand and walk, the pressure is not coming on that ulcer area, the ulcer can heal.
So, like you said, most people live with these ulcers and cons for more than 2 to 3 years. You think ignorance, there is some kind of ignorance in people about taking care of their feet?
Yes, of course, because for every problem, taking a pill is the only solution. That is the mental block. So many times we get patient and we tell them, we do this, we offload. They are like, नहीं तो मेडिसिन नहीं प्रिस्क्राइब करेंगे, अच्छा तो सर्जरी नहीं करेंगे. एंड देन वी टेल देम व्हाई वी डोंट डू सर्जरी. दे विल बी लाइक, हाँ मैंने 2 साल पहले सर्जरी किया था. तो आपने ऑलरेडी सर्जरी किया है, आपने मेडिसिन ट्राई किए हैं, यू नो नाउ दैट इज़ नॉट वर्किंग, but still you're not ready to accept another approach.
Yeah, I think this is a mental problem in India where people mostly think that like there is this whole ignorance about physical activity and physiotherapy actually being more effective than sometimes taking medicines.
Yes, that's
So
right.
I think good we started this podcast so we can tell more people about getting better without taking medicines.
Yes, that's.
So doctor, I have also heard about something called as a heel spur. Can you tell us more about that?
So spur also get formed around the near the origin of plantar fascia, and it is when the initially it's plantar fasciitis, and when it is not treated at the right time, and when the irritation of plantar fascia continues, the calcium gets deposited over there, and then when we person do the X-ray, you can see the bony prominence over there, which is called as a spur. But spur doesn't cause the pain. It's the plantar fasciitis, the inflammation of the soft tissue, that causes the pain. So even if someone has a heel pain and they have a spur, they feel like इसको तो भी सर्जरी से निकाल सकते हैं, but it's not. If we'll manage the inflammation of soft tissue, the pain, even person who has a spur, still they can live the pain-free life.
Okay. So doctor, what happens when someone ignores chronic heel pain for a long time? What's the worst that can happen?
Yeah, so it start with the simple. Obviously, suppose someone is starting heel pain on the left side. Okay, they are keeping ignoring, but their body will try to compensate. They will try to shift the weight on the other leg, and then in few months they start getting heel pain on the other leg also. Or sometimes they will walk such a way that they will not touch their heel down. They will just keep pressure on the toes. That can lead to the forefoot pain, but that will create a hike in the pelvis. So that can lead to the back pain also. So it start with the simple heel pain, but then eventually they will get the multiple pain like a knee pain or the back pain also. So we had one patient, she was a housewife, and she came to us for the heel pain. We analyzed her foot arch walking pattern. There was a slight up down in the knee. Probably it was all compensation of the chronic heel pain. And we started with the arch support correction for the plantar fasciitis. In the follow up, her heel pain was also gone, but she was so happy that the knee pain and the back pain, which she was living with for so many years, even that got better. So the simple heel pain cause lots of complication, and plus person can't increase their activity level. If someone is going for a walk, someone is going for the gym, because of the simple heel pain, they just can't do any activity. Now there are many people who have a diabetes at the middle age, right? And obviously doctor advice you have to walk 45 minutes, 1 hour every day, and because of the heel pain they can't walk, so their blood sugar also spikes, so it can create lots of complications.
Okay, so let's come to the solutions now. Like, what are the most effective ways of treating heel pain and plantar fasciitis?
Okay. So as I say for example, suppose you go to gym and you say injure some shoulder muscles, you will take a break for 2-3 days for the shoulder workout, and you will rest, maybe ice, and it will get better. Okay, but why the heel pain doesn't go that way? because our standing walking is integral part of our daily routine. We can't really stop that. So that's why the plantar fascia doesn't get rest or it doesn't get time to heal. That is the main thing which people ignore. So first thing is take a rest. Okay. Second is the cold pack. So every day you stand or walk certain amount of steps, that is going to create a new inflammation at the heel area. So that is best settled with the cold pack. Now, painkillers, it works SOS, but for how long you will take the painkillers? So we get many patients who are having heel pain for 6 months, 1 year. Now, for 1 year, you can't rely on the painkillers, right? And obviously, they have tried the painkillers. They have tried steroid injection at the heel area, but still it doesn't go away. So the main line of treatment for the plantar fasciitis is we have to support the arch such a way that it will reduce the stretch on the plantar fascia. And when we do that, in 2 weeks also patient will start experiencing the relief, and in 4 to 6 weeks the pain is completely gone. Most of our patient on the day when they are find it difficult to believe because they are having since pain for 2 years and they have tried so many remedies, so many therapies, ayurveda, what not, and they have in the end lost hope कि ये pain कभी जाने भी वाला है मेरी ज़िंदगी से. And actually when we start with the orthotics, in 2 weeks the magic happens, the pain gets better. So when you have the foot pain, it is directly connected to the kind of footwear you wear. So if we'll rectify that, your pain will be sorted very soon.
I think I have a personal story about this also. Like, I had a friend who we used to stay together in an apartment, and he would always come back from work and say that my heels are paining. And he used to work in the salon industry, so mostly I think he was on his prolonged standing. He was on his feet most of the time, and he would come home and say like, bro, just beat my heel, ऐसे just hit me on the heel for a few times till I feel better. And that just gave him a temporary relief. But like, I regret not knowing about this earlier, so that I would have recommended, you get proper treatment. I will send him now.
Sure. So people who have a prolonged standing job, it start at the early age. Like I'm sure he must be young person, right?
Yes.
So people who work in the salon or the hospitality industry, hotels and all, they really stand a lot. Okay, so yeah, then plantar fasciitis or the heel pain can really hamper their lifestyle. So the employer should be like more considerate for their employees. If you are expecting them to stand for 8 or 12 hours, you should get them check their foot screening done and provide them with the right footwear, so they will be able to stand, walk more without the pain, and obviously they will perform better. If person is having nagging pain, okay, they will not be focused on their work, right? So employers should be more considerate for their employees.
Okay, so one question I want to ask, is there ever a chance that surgery is required to fix this problem?
See, theoretically there are options, but I don't think so. Even usually orthopedic surgeons also recommend the surgery. I have seen very 1 or 2 patients who has a retrocalcaneal spur and they have got it operated because they were very prominent. But even post surgery, I guess it was 3 months post surgery, he was in terrible pain because now the spur was not giving the pain. It's Achilles tendon which is inflamed that was causing the pain. So if we will fix the right orthotics, right shoes, surgery is not needed. And for the heel pain, so definitely it's not the.
So is orthotics the only way to solve this problem, or are there any other methods?
So orthotics is very important part of the treatment, but apart from that, there will be lots of muscular, disalignment. The person might have the calf muscle tightness. So proper targeted physiotherapy for the stretching of the calf muscle or if strengthening of the foot and ankle muscles. Plus, if they might have vitamin D3 deficiency, so that also need to be managed with the proper supplements. So it's a combination of the podiatry, orthotics plus physiotherapy and plus medicines SOS. So these three together can manage the heel pain or plantar fasciitis very well.
Okay, so would you recommend any sort of exercises for our viewers, who are starting to feel the sensation on their feet? What can they do at home feel much a
So,
bit better.
yeah, sure. So, when the pain is very acute, a person can use the, say, 10 rupees water bottle, make it ice cold, and they can roll it under their feet. That will give a good effect of the cold pack, and plus it will release the plantar fascia. Eventually, they can do that same exercise with the tennis ball also. Even stretching up calf muscles, because most of in these cases the calf muscles are tight. So stretching up the calf muscles also works. So these are few exercises which works in the long run for heel pain.
So, doctor, I have one more question. Like you said, orthotics are the foundation for this treatment. It's very important to get things started. Um, I'm sure women and also guys must be having a lot of questions like, do I have to wear these shoes or this particular pattern for the rest of my life? Because with so many options available, people are fashionistas, and then now you tell them you can only wear this certain kind of shoe.
Yeah.
So, do they have to wear this for a lifetime, or how does it work?
I see most of the cases it is lifestyle change, but it's not like they, lost all the options completely. We advise proportion of 80-20. What is 80-20? 80% of your routine you wear the corrective footwear, okay, and 20% it's your liberty, you can wear something else. So for the occasion, function, party, you wear something fancy. It will not even give you much trouble if other time you are wearing the right footwear. Usually we decide our footwear the way we are dressed up, okay, but usually you have to decide your footwear how much amount of standing and walking you are going to do on that day. Okay, for example, if you're going to the mall and you're going to for a shopping, you're going to stand for 2-3 hours, then better wear the sports shoes. You're going for a movie or you're going for a dinner, okay, you're just going to sit there, you wear anything fancy, right? Many times I have seen, there are parks or zoo where we have to really walk a lot, and I have seen young girls, they really dress up and they wear heels, and I'm like, how you will walk in the heels for 2-3 hours? It will look very nice in your selfie, but that is not how you should decide your footwear. You wear it for the function and parties. You're not going to stand and walk much.
I used to recommend this to my ex-girlfriend. So, don't wear heels. We are going out for a trek. How
Yeah,
are you
it's a
going
simple
to
logic,
wear heel
right?
shoes on a trek? Okay, so doctor, can you tell me, have you ever treated somebody which was an extreme case where things have gone too far?
Yeah, so there was a woman, her age was 30, and she came with the heel pain on the both the side, and she was having this pain for like 1 or 2 years. And then obviously she tried medicines and then the injections, steroid injections. So she took 5-6 steroid injections. She's like, I don't know, मैंने left में कितना लिया, right में कितना लिया. She actually lost the count of it. She has such a big file of all the medicines and lots of stuff then, and still she was walking with like lot of pain. So when we analyzed her foot pattern, she was having like really bad flat feet. She was working for the NGO where they used to go for the surveys and all, and obviously she was wearing something random for that. Okay, so then she opted for the wearing sport shoes for outdoor, and we started with the proper arch support footwear. And in her case, it took little long to get rid of the heel pain, but at least in like 2 months, her pain was totally relieved. So that I feel bad about, because patient feels कि अभी मैंने last resort तो कर दिया, injection ले लिया, and still my pain is still there. And someone who is in 30s, who has their active job is there, it is mentally very depressing for the patient. So even on the day one consultation, she cried because of the pain. And after 2 months, when she got relieved, when she was again telling me about the story, that time again she cried. She was married since 2 years. They were planning for a baby and all, but because of the pain, they were like very reluctant. They were very worried that if I'm having so much pain, how I will get through the pregnancy and all that stuff. So in few months, her pain got relieved. Another 6 months, her husband came with his father for some other problem, and we asked, how is she and all. Then she is already expecting. So that
Okay.
is something, the simple change in the footwear, how much impact it can make in someone's life.
True. I can understand. Like, if your feet are holding you back, they might be holding you back in so many aspects of your life, and so many opportunities might be missed because of that one sensation in your foot, and
Yeah.
you're not giving your best, you're not feeling your best. All right, so I think we have covered most of the topics.
I think so, yeah.
And thank you guys so much for joining us again. In the next episode, we are going to be talking about corns and calluses, one of the most annoying food problems that you can have. So, if you guys have any questions for Dr. Sarika, leave them in the comments. Don't forget to subscribe to our channel, like, share, and follow. And we'll see you in the next episode. Tagline, Hamala. Take care of your feet.
Till then, take care of your feet because every step counts.
Okay. Till then, take care of your feet because every step counts.